So, we have heard some great lectures this morning, and I'm not going to bore you down to some more details about glutathione because, just a show of hands, I'm going to do reverse. Who have not heard about glutathione? You see that? You see there's no hands up there right now? So that's what I'm saying. I don't need to tell you more science about this thing, but I do want to discuss with you something that you may not know about glutathione. And so I hope this is intriguing. This is educational because that's the whole purpose of this thing. Objectives are objectives, and I hope to accomplish one of them. Does oxidative stress have a role in metabolic disorders? I think we all understand that there is some oxidative stress that has some role in metabolic disorders and brain health. And I want to assure you that if there is a role and if there's a way to reduce oxidative stress down with the help of glutathione and other antioxidants, that we should see a positive impact. And so I want to make sure that we go through that today. Of the top 10 leading causes of death in 2022, if you remove accidents, and at that time it was COVID, the other 8 are all linked to oxidative stress. And we just want to make sure that I want people to understand that it is when people ask me, I said, hey, I want to have something for longevity medicine. The only way you live longer is if you don't die. So I think that we can make it very clear that if something is causing death, then I need to reverse that or stop that from happening. It's a very simple concept, but we don't have to make it overly complicated, okay? So my focus today is, what are the reasons of death, and can I reverse some of these things, right? At the same time, I want to live a life. So that's why oxidative stress reduction helps us live a healthier life. So let's talk about, I want to go about health, about brain disorders first, because this is something that I can wrap my head around it, and it's just so difficult to deal with it. And so when it comes to Parkinson's, oxidative stress arises from dysregulation of the cellular redox activity. It's not as pathological as we think it is, but it's the accumulation of the Auro species that mediates the neural changes early on. And so that's what this is all about. There's plenty of research out there. I'm just going to go through this very quickly because I want to get to the meat of the whole technology piece that we have created. Oxidative stress in Alzheimer's, 2% of the total body weight is your brain. But guess what? It consumes 20% of all the oxygen we breathe in. Our brain is most vulnerable than any of the organ to oxidative stress. There's a whole bunch of articles. Pathological hallmarks of Alzheimer's disease is senile plaques. But guess what? The oxidative stress is increased, which is more associated with the synaptic loss at very early on, even before the pathogenesis of Alzheimer's disease. We want to prevent as much as possible because treating diseases is something that we are not going to accomplish of longevity. So my goal is to figure out a way, what markers can we have to make sure that we are able to stop the progression of the diseases. Dr. Pravat Mandel, Dr. Joe Maroon, the privilege of working with them in the last 4 years or so. And this is their way of measuring, assessing glutathione levels, GABA. They're measuring TCA levels, glutamate and glycine GABA cycles, all the metabolic pathways. They're measuring that with MR spectrometry. And so we want to figure out, we don't have to do a blood test for every single thing. If there are other technologies that exist that we can give a better picture, I think Dr. Mandel's team has been doing a tremendous work in this facility, and I'm hoping that we will get some funding so we can do some more work with our technology as well. Antioxidants and brain health. The brain disorders have been linked to basically altered GSH to GSSG ratios. We always want to make sure that the reduced form of glutathione is probably the highest in the body compared to the oxidized form of glutathione, which is a GSSG molecule. And And with anybody with Alzheimer's or Parkinson's, what we are seeing is the ratio is lowered, where we have lot less GSH and a lot more GSSG molecules in our brain. There's another study, again, Dr. Mendel's work. Glutathione plays an important role in the brain antioxidant defense system to maintain redox homeostasis. And so the depletion of brain glutathione has been observed both in the autopsies as well as in vivo MRI studies as well. So this is not something that is, most of the brain health studies are a lot of them are in vitro, and so we want to make sure that we also do some in vivo studies as well. This is his work. Again, this is a recent publication. I'm not sure this is the final copy or not, but I was given the pre-publication copy. This is the copy of that one. But again, they found out that measuring iron levels can also tell you the as one of the markers for oxidative stress in your brain, especially for the Alzheimer's patient. So this is another study that he has done, one more study that just got published recently again. The risk for Alzheimer's and Parkinson's disease can be evaluated by measuring plasma glutathione and serum iron concomitantly. So we want to make sure that if you're looking for blood tests, looking for plasma GSH as well as iron, that can somehow give an indication that there may be early onset Alzheimer's or early onset Parkinson's. Now, the roles of this, what can we do to reduce oxidative stress down? There's, of course, antioxidants, caloric restrictions, physical activities, and reduce oxidative stress down, hopefully in the hopes that this will prevent cognitive decline and help brain and help with Alzheimer's. When it comes to Parkinson's, there's a significant improvement using in Parkinson's disease rating scale when they use glutathione. They have shown that they may improve motor skills. Again, it is not changing the course of Parkinson's itself, but just improvement in motor skills alone can improve the quality of life for these patients. But there was no significant decrease in the side effects because of glutathione and the control group. So that was just a good sign. So I want to go with some of the clinical trials because this thing tells us what's been studied and what can we do further. Because one thing I like to enforce, I work with a lot of researchers, and what we do is when somebody comes to me and asks me this question, hey, I'd like to research on this glutathione product that you have created. I said, I will give access to this product only on one condition. You publish the data whether or not it works or not. And I want people to understand that sometimes the key learnings are when something does not work. It's not when something actually does work. And so I want people to make sure they publish data that if something doesn't work, we want to publish this data out. So these are some of the things over here. So this study was done on glutathione, on CoQ10, high dose of CoQ10, and what it came as a result. These all came from clinicaltrials.gov, by the way. So this is something that one of the researchers pulled up all the data from clinicaltrials.gov. It shows that it was safe at 1,200 milligrams per day, CoQ10, but there was no significant improvement or reduction in the progression of the motor dysfunctions. So for the Parkinson's. This was another 12-month intervention. The slides are too small, I can't read. This was a product called MitoQ, I believe. Yep, it's MitoQ. Again, it's a branded product they use. They saw no clear evidence of any benefit, and even at high doses at 40 and 80 milligrams per day for 12 months. Another study that was done, a 3 months intervention. This time they used glutathione inhalation solution. And what they found out was there was no clear evidence of benefit of using this product in this dosage form. Another trial that was done, this was a 4 weeks trial, I believe so. High dose intravenous form of glutathione. What they found out was it was safe to use up to 4.2 grams per week, but did not show any preliminary evidence of clinical benefit. I met Dr. Perlmutter in New York earlier this year, and we talked about some of the doses you are using, and you are using 5 grams up to 10 grams of IV pushes to see some benefits. And the question I asked was, said, Is it everybody gets the benefit? And I think you had some hesitation at that point. Is that it's there, but we still have more studies to be done to actually figure out at what dose, how much is getting into the substance nigra or the frontal lobe, wherever we need to be. And so learning all this thing is very critical for us. Here's one other thing. This was the ultimate thing, right? This is what we found out. They were using, is this cysteine? N-acetylcysteine, up to 3.6 gram, 3.6 gram per day. And this was done in 2011, and the results were never published. And this is what I'm talking about. I want people to publish whatever comes out. We can all learn from it. Life's too short to hide, and life's too short to not know what everybody else knows. And so I want to make sure that I'm open with everybody, that whatever that I do, the research that I do, I'm going to publish every single thing, whether or not if it works or doesn't work. Because at the end of the day, I want to make sure that we learn from here, because I'm going to get old. I don't know about you guys. I want to get old, and when I get old, I want those young folks in this audience to treat me when I do get old, and hopefully they learn from something. But glutathione does not cross blood-brain barrier. That's the biggest challenge we always found out. Dr. Mandel's group is working with us right now, and hopefully we'll have a research started very soon to see if the application that we have created can get there. And that application came in from this one particular study that was done. They were able to deliver quercetin, and it was able to cross the blood-brain barrier using gamma-cyclodextrin complex. Hey, there's a hope. There is hope that there is a way we can actually improve glutathione levels using similar delivery technologies, right? And so this thing was good to me. And so based on that, we have a couple of researchers. Full disclosure, I am not involved in these studies, but I know all the researchers because I'm on the Dean's Advisory Council at the Western University School of Pharmacy and Medicine. And these professors over there are also on my Dean's Advisory Council, so I can get a discounted rate to do some clinical trials. As you know, clinical trials are super expensive. And so I didn't pay them. But they did some trials, and so these are a couple of the results. This one, if you take a picture of this one, I don't have a copy of this one yet at my booth outside, but this particular was talking about treatment of acute and long COVID, diabetes, myocardial infarctions, Alzheimer's. I mean, these are variety of diseases. What's one thing in common? Right? Oxidative stress. No, I'm sorry. Let me just go back. This was published in Journal of Antioxidant. It's a peer review process that they got this thing done. And the idea behind this thing is to let people know that the common cause for all these diseases is ROS species. And when your ROS species is high, there's a cytokine storm, there's issues with metabolic disorders, that insulin resistance that kicks in. And so our goal is to do what? Can we balance it? Now, I'll go one step further. This is what we have always seen. We can somehow get a balance of ROS species, and the three things we need is what? Exogenous form of vitamin C, vitamin E, selenium, CoQ10 maybe. Endogenously, the body can produce enzymes like superoxide dismutase, glutathione peroxidase, catalase, or endogenously, the body can produce non-enzymatic product like glutathione. Three ways to reduce ROS species or bring it in balance. By the way, you cannot tip the balance. You cannot have too much antioxidants and not enough ROS. That doesn't exist at this point. Wait a second. It does exist with the technology that we have developed now, because now for the very first time, I have tipped the scale where I can reduce oxidative stress down to 0, or it could go negative. And when that happens, it is not healthy for us. And that's the reason why I'm out there talking about these things, about glutathione usages correctly, because using a high dose of glutathione may not be the best option for us. Finding the right technology, the right dose is very critical for us. So again, first things first, avoid toxins, right? Thank you, Nikki, for providing this beautiful meal today, which is free of a lot of seed oils and a lot of healthy choices we have today. Avoid toxins, number one. Dietary changes, make sure you have cysteine-rich foods or the amino acid-rich foods these are the building blocks. Third thing, physical activities to reduce oxidative stress. Again, a little stress is always good for you. Too much is not good for you. But without a little bit of oxidative stress, your body becomes lazy. You want body to be resilient. And so physical activity is great for you. And of course, antioxidant supplementation therapy is always the last resort. But we tend to, I'm as a pharmacist, I make my living selling antioxidants. So that's my first choice. But guess what? I don't have to make the first choice because people are not going to do the first three things that I ask them to do because they are too accustomed to the modern day conveniences. We all are. I see a lot of plastic water bottles on the desk over here. They should be off, right? But we still have it. Glass is better if possible. Anyways, that's a soapbox. Okay, a little form of glutathione. There's a lot of misinformation out there, and I want people to understand that there's oral capsules, liposome technologies, intravenous forms, creams, suppositories, inhalation solutions, topical glutathiones. I mean, there's everything out there. And let me tell you one thing. They all work. Okay, let me just tell you one more time. They all work. But you have to know how they work and why they work, because then when you have a patient population that does not respond, then you should know which therapy you should be implying to get the response you're looking for. So oral liposome technology product was studied in 2011 at the University of Texas in Austin, and they took 26 kids, autistic kids. 13 kids were given oral liposome glutathione. 13 kids were given topical liposome glutathione. 100% of the patients, what they saw was increase in cysteine in the first couple of days because the glutathione was getting broken down into 3 amino acids. Cysteine was getting reabsorbed. Cysteine was actually being used to produce glutathione. So the glutathione levels did rise, but not until the cysteines were increased first. Okay? Second thing, 1991, this study was done where they're given 2 grams of IV push of glutathione. 100% of the glutathione was found in the plasma, nothing in the red blood cells. They didn't inject cysteine. What they did see was a rise of cysteine in the blood in the first 90 minutes. So cysteine is actually being used to produce glutathione. There's nothing wrong with this whole picture, okay? We see as a buffer that, hey, I can inject glutathione and the body will break it down, use up what it needs, and I'm okay. I don't have to worry about overdosing or underdosing anybody. I can just get a little bit more and I should be okay. And that's fine too. But you should know that cysteine is the one that's getting reabsorbed and has been used to produce glutathione, and that's how we increase glutathione levels. Okay? Or we can do what FDA has given us is N-acetylcysteine as a prescription item, Mucomyst, if in the hospital settings. We use that in the hospital as to improve glutathione levels naturally, right? So that's another way of doing it too. So I want to go over the technologies because I'm a pharmacist and I get a little bit nerdy and geeky when it comes to technology piece, especially delivering molecules, right? This is my bread and butter. So there's this technology exists as polymeric NPs, which nobody uses a whole lot. Liposomes, which is widely used right now. By the way, we made the first liposome form of glutathione in 1999. The inventor of liposome technologies back in the early 70s came to us. He was in his late 80s at that time and said, hey, can you make some vitamins with liposome technology? I said, well, I can try. And so we made the first liposome glutathione, liposome vitamin C, and it did not work for my patients for liposome glutathione, so we didn't make that one, but we did make vitamin C for long periods of time. The metabolic NPs is another technology, and the dextrin is relatively new in terms of pharmaceutical side. It's been out since the 80s, but nobody has developed a whole bunch of products using this technology, right? People use cyclodextrin. Okay, if you have, I know you don't have cereal boxes in your home, but if you have a cereal box for your kids, look at the box. There's something called maltodextrins in there. All those dextrin molecules inside all these packaged goods is to control the odor. okay? And so this was discovered to control the odor. We have taken to the next level and used a technology to actually stabilize glutathione, deliver glutathione through your skin, and do all kinds of other things with the technology right now. For the very first time, what we found out is by combining glutathione with the cyclodextrin technology, cyclodextrin actually has an affinity for the ACE2 receptors on top of your lipid rafts. So if you look at the lipid rafts, these are the non-lipid rafts right over here. The lipid rafts, the receptors over here has an affinity of cyclodextrin. So cyclodextrin, when it comes into contact with the receptors, as long as I can put the glutathione inside the cyclodextrin, voila, I can deliver through your into your cells using this technology. The only downside is the cyclodextrin hypothetically is this small, versus glutathione is 80 folds bigger. How do I get this big molecule and shove it down to the small little rings? And that's what we had worked for over 5 to 7 years, trying to do protein enveloping method, trying to figure out different ways without changing the polarity, and if we can stuff inside this ring. And when we did that the very first time in 2007, what we found out was, whoa, this was way too powerful, way too fast acting, and we had to quickly shut down selling this product to the doctors. And it took me 13 years of research, trying to figure out what to do with it. And so we've done some clinical trials right now. We've done a lot of N1s, like one-patient trials, which we have published in my book. But we have done some trials recently. This was not published as a clinical trial because in March of 2020, when they initiated this research, the IRB was shut down at the university. The university had not given IRB to the university itself. They still ended up doing the study, but it was published as a manuscript. So it gives you some idea is that they were just trying to publish with like 1,000 patients. And out of 1,000 patients, they only took like 10 cases, and they saw the complete remission of all symptoms in 2 days. The worst case scenario was 8 days. I'm talking about 2020 March, not 2024. And so if you read this, if you get this article, it's outside, or get it online, and read between the lines, because you can see how the Dr. Yutani, who was also the chief doctor at the medical center at Western University. So he was using in his patients in the ER over there, and this is what it was published based upon. So 2 years later, they did get an IRB approval. They did a first human trial, 30 subjects, placebo-controlled, and this was a 3-day trial, and they saw 100% of the patient that took the active drug increase in the glutathione levels. In the RBCs, glutathione level went up, and the PBMC levels also of the reduced glutathione went up, to the point that within 4 hours, they saw a reduction of the melanaldehyde levels in vivo. So immediately they saw a reduction of oxidative stress markers came down. Now, the researchers were, the IRB, to get an IRB, they insisted on doing a study with Mycobacterium infection. I think one of the persons on the IRB board was asking them to do another study for Mycobacterium. So what they did was they basically drew the blood, infected the blood in the test tube with Mycobacterium, and 3 days later they were measuring all the cytokines, IL-12, IL-2, interferon gamma, TNF-alpha. They all rose because of the Mycobacterium infection, and to their surprise, 1 hour post-infection, the sample they took, they saw reduction in the Mycobacterium load. And this alone basically sent some shockwaves to the researchers that, hey, glutathione is not antibacterial, it's not antiviral. What does it do? It is actually strengthening your immune system. It's reducing oxidative stress down, strengthening your own immune system. And so this has triggered 2 more additional trials right now that we are funding. And hopefully there will I have no idea what they are at the study at this point yet, because I'm completely hands-off on that trial. But hopefully we'll get some data coming up pretty soon on that as well. The researchers has also submitted 2 other publications, one for PTSD case and one case on I forgot the other one. There's two more publications already been submitted for peer review right now. So we'll have some more data right now. This is the product. Now, so we talked about glutathione dosing. So let me just tell you about dosing. When I first discovered the product in 2007, we were dosing based on what's in the guidelines, 200, 300, 400 milligrams topically. I was giving up to 600 milligrams topically. Oh my God. We had reactions up the wazoo. Headaches, diarrhea, stomach cramps, rashes all over the body, extreme fatigue. People cannot get out of the bed for almost 3 days in a row after a single dose application. And we quickly realized that we were overdosing these patients. We stopped the trial. We stopped using the product immediately. We had a doctor in Utah help me out. He did a trial to figure out what doses is appropriate. We found out that 100 milligrams of topical form of this formulation was enough to raise your serum glutathione, RBC levels of glutathione to up to 950 to 980 micromoles per liter. That's high normal. So that's the therapeutic dosages. That's the maintenance dosages. That's the dose you need to do is 100 milligrams, which is about 4 sprays of the regular product of the glutathione, not the plus. But like everybody says, right? A little is good for you, more is better. No, it's not. No, it's not. The plus was introduced about a year and a half ago, and we had some celebrity clients that they have not asked me to release their names out, but the parents were dying off of COVID, and they came back home within 3 days, and so they said, I want the plus version. And so we released the product. So now we have a lot more data coming out with the plus version right now, but more is not better. So if you guys folks, if you ever use this product in any of your cases, please watch out for the side effects: headaches, extreme fatigue, tiredness, stomach cramps, diarrhea, rashes. If that happens, your dose is too high. Even at 100 milligrams, dose is too high. I have gone down to as low as 12.5 milligrams for somebody just so that they don't have any reactions. Okay? So just FYI, if that ever happens, reduce the dose down to as low as possible until the patient can tolerate. Slowly increase the dose every 3 to 4 days. You're going to have tremendous results. Once they get a therapeutic dose of about 4 sprays, which is about 100 milligrams BID, you're going to have the profound impact in their life within 2 weeks. And so people that have the highest amount of side effects will have the best outcomes in about 2 weeks once they reach the steady state dosages. So hopefully you get some information on that one. In conclusion, I just want to make sure you realize what we have done. We have delivered a tripeptide through your skin, through your cell walls, into the intracellular levels for the first time. You know how profound that thing is? I cannot even fathom my own brain sometimes, but we have used this technology. If there are researchers out there, please look at this technology, see what else can we do. My goal is to put this out there so people can use this product and use this technology to develop additional products that we can develop there. We do have 7 patents right now approved on this delivery mechanisms and all these things, but I'm happy to share with anybody because world needs better products for us. And I hope that my work that I've done so far inspires people to do additional work. Systemic benefits of topical glutathione has been significantly to reduce the oxidative stress. I think we can say that if I can reduce oxidative stress, we can improve longevity by improving health span. And it's OTC, no prescriptions. People can use it today without any concerns. The only concern is the side effects. That's my book, The Glutathione Revolution. Thank you, Dr. Mark Hyman, for giving me the forward to my book. Appreciate that, always. I'm here. I have any questions? I know the lunch is short, but I want to make sure, thank you for your attention, thank you for your time. I'm here if you have any questions. I can answer questions. Otherwise, I'll be outside and I'll be any questions you have. So thank you very much.